Hey, everybody. Thank you for watching this little impromptu webinar that Dr. Frederick and Dr. Guiliana and I are sort of co-hosting a little bit with you. The three of us had a conversation last week about something totally unrelated to this little webinar. But the conversation turned towards the compounded COVID conundrums, I guess, triple C, that we're gonna talk about here, as far as staff shortages, employee problems, not only the finding, hiring, keeping, motivating staff like everyone's always faced, but right now when we have doctors and practices that are either closing temporarily because there's no one working in the office, everyone's out with COVID or home taking care of COVID kids, or there's maybe one employee left out of a small group anyway. So we just kind of thought that we'd all share our thoughts and opinions and maybe give some little tips on how we can just keep our heads above water and then, you know, survive what hopefully will come to an end at some point. So let's talk about it. John, what did you, the story that you told us specifically?
Yeah, I mean, this topic came up during an unrelated conversation that we were all having. And I think everybody listening to this recording probably would agree that this problem is pervasive, not just in medical practices. You go to restaurants and you can see the short staffness. You go to grocery stores, you could see the shelves that are empty. It is a problem. It is a challenge. It's a challenge that is going to be temporary. So I do think this is all going to pass, but it's a challenge that I think, Cindy, philosophically really forces us to think differently, right? And I think both of you have heard me always speak about the difference between those practitioners that are just super thriving in any environment versus those that always seem to get left behind, right? It's because their mentality, their paradigm never changes when we're faced with something like this. And obviously out of adversity always comes opportunity, and it's no different here, right? So yeah, I speak to a lot of podiatrists who are short-staffed, no staffed. I mean, it's impactful as a result of either employees being out with COVID or as a result of the data that we're seeing globally. I mean, just in the United States in November, I just read a report a couple of weeks ago, 41 million people in November left their jobs. 41 million people. So this is not specific to your practice. It's not specific to podiatry. This is pervasive. And what it forces us to do, and I mentioned this in our unrelated conversation, is respond. We have to respond. Our first response should be to really throw out, if you will, all previous management rules, right? Cindy and I, you and I have spoken about management rules, right?
Right.
Delegate, 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 delegate. Train your employees.
Scratch that, reverse it. Yeah.
Throw the rule book away at this point. You have to survive. So you throw that rule book away, you roll up your sleeves, you go to work, you do whatever is necessary to get through this transient point in time. Okay. And Jeff and I, we're old timers. I'm sure Jeff, like me, you had to at one point in your very early career roll up your sleeves, vacuum rooms, do whatever you needed to do, take patients in and out of rooms, answer your phones, whatever you had to do.
Well, that's sort of what prompted me to ask you both to do this was, John, when you said time to roll up your sleeves, and that is absolutely true, because never before, I've been in this field for a while now, like a couple decades, I have never seen anything like this where, you know, at the beginning of the pandemic, it was like, okay, We have to see only emergent patients. We have to keep our diabetics and our infections and our wounds out of the emergency room. We have to keep it clear for COVID patients. And now, the patient schedule is lighter because people are canceling because they have COVID or they've been exposed or whatever, but the whole staff is out.
Yeah. And rolling up your sleeves is the phase one of this response that I'm alluding to. But here's what's going to separate those who once again are going to thrive versus those who are still going to always be left behind. Ultimately, this should teach us a lesson, right? This should teach us a lesson. Lessons that other industries have been ahead of medicine for quite some time. This is the opportunity to look around you and say, okay, in the future, this will never happen again to this extent to me, because I will do one of three things. I will either make sure that as much as possible, processes are automated. I will make sure as much as possible and reasonable, processes are outsourced. And I will make sure as much as possible, I would look at every process that I do in the office and determine its scalability. So what does all that mean? And please chime in whenever you wish. But as far as automation, I sometimes am flabbergasted by the lack of automation that I see, even in the most conceptually modern practices when it comes to their surgical techniques and whatnot. Simple things like patient engagement, having patients actually enter data into your software rather than burdening your staff to do that. Simple things like automating your recall process rather than having a human actually on the phone calling somebody to remind them of their appointments. Automate that process. Simple things like automation of patient eligibility. Those are the things that really this pandemic should force us to look at and take a hard critical look at what we can automate. And second to that is the outsourcing concept. What can you outsource? If you're doing your own payroll, should you be? If you're doing your own billing, should you be? Those are things that you look at critically to determine whether you outsource. And then lastly is the scalability concept. There's always going to be tons of processes that you can't automate, you can't outsource. But look at them from a scalability perspective. And I'll just throw one example out there that doesn't fit everybody, but it is just purely an example so that everybody understands the concept. When you're short-staffed, maybe this is a time to look at siloing your schedule. So in other words, you put all of your routine foot care patients on the same day. And that makes that processes associated with routine at-risk foot care standardized. And it becomes much simpler for less human resources to handle. And you could do that with so many other processes in terms of standardization.
I think more of my practices have made major schedule changes since, the past 18 months or so, when they've done, routine foot care Friday mornings, and they've moved all of their in-office surgical procedures to Thursday afternoon because they have the most staff available on Thursday afternoon.
So scheduling in itself has always been, I think, it's the lead to how the practice is going to function during that day. So you are absolutely right. I love the siloing of it. I love looking at your schedule and saying, okay, what are we doing wrong here? Because everything is so mixed up. I got a post-op mixed in with a new patient. I can't spend the new patient time because I got a post-op complication now. So it becomes an issue. But I want to focus in on scheduling because we're talking about how to adapt. And John, you talked about automation. If you're down to you and one other person in the office and you're trying to run the office, and God forbid it's just you and you've got to see those 40 patients today, think about adapting how you reschedule people by bringing the laptop into the room if you don't already have it there. Dental care has been doing this for years. You have your teeth cleaned and right there, the dental hygienist is, let's schedule your next appointment. Well, if you're a one-man show or one-woman show, scheduling not only is how you're scheduling your patients, but where you schedule them will make or break you, because you're not going to leave the room and then go up front and schedule somebody. It just can't
Yep.
happen when
Yep.
you're down to that kind of thing. So scheduling, I think you've hit the key right off the bat, is scheduling.
Everything from scheduling, telephone management. I mean, you can outsource so many things temporarily to get through this time.
One of the things
Temporarily becomes permanent when they see the benefits
Right.
of the
Yeah.
outsourcing.
And
that's
no matter what you're doing in this environment, when you are short-staffed and everything's going wrong in your mind, you said it earlier, John, people know we're in a pandemic, and people know there's for hire signs everywhere, and they know that it's going to take longer. What they don't know, if you don't say it. So if I have a busy practice and we're so far behind because we only have half a staff member, repeatedly saying that, I understand your frustration that you had to wait a long time, but we are so short-staffed because of COVID, because of the pandemic. People immediately excuse it. It's part of our culture now. I already know if I'm going to go somewhere and I'm going to have to wait, I have to expect it. So unless you say it. So my tip number 2 on this topic would be, repeat that to your patients. I am sorry, apologize, but it's a COVID issue. We don't have the staff. And people will immediately dismiss it. John, what is the average? After 20 minutes, people get pissed off if they wait longer than 20 minutes. Isn't that, there's a number. I think it's 20 minutes.
Yeah, I think
And
that
me,
may change.
I'll get pissed off after 5, but I'll wait an hour if somebody's already said, I'm so sorry because it's a COVID issue. We're so short-staffed. I feel bad for them. And
apologies go a long way. I mean, apologies go a long way in the first place, but just to have, I talked about this on my own webinar last week. Don't be afraid to put up a sign, like every restaurant, every takeout place. When I go to the vet with my dogs, there's a sign that says, you know, please forgive us, we're short-staffed. Please be nice to the people that showed up to work today, because, you know, people are not showing up, or they're calling out sick, or they're, you know, kind of milking it in some cases of like, well, my kid may have been exposed. Should I not come in? I mean, there's the CDC keeps updating their rules, because it's like, if you're a healthcare worker and you're vaccinated, if you have been exposed, but you have no symptoms, put a mask on and come to work.
Doctors don't like, most doctors have problems with saying 2 things. One is showing a weakness by saying, I'm sorry, but that's not a weakness, it's a strength. And the other one is, can you send me some patients? Are you happy?
Right.
Those 2 things doctors struggle with. I don't know why, but.
Well, the other thing is that I've talked to a lot of my doctors about recently. So, you know, I would always say in past years, like, oh, let's look on Indeed, let's put an ad on Indeed, let's be very specific, let's have them do exams, let's assessments. And then it just started getting worse and worse when, you know, doctors would be paying me an hourly rate to be interviewing via Zoom for them because they were short-staffed. They need to see patients, right? And I'd sit on here, wait and wait and wait, and get ghosted time after time after time. I used to schedule them 15 minutes apart, because then I wouldn't be wasting too much time when they ghosted me. And now I feel like with unemployment the way it is, people through Indeed and all these other online job recruiters, all they have to do is prove that, hey, look, I set up an interview with this person, and no one follows up to see if they actually showed up virtually or in person. So now I'm saying you're going to have to get creative. Put it on your Facebook page for the practice.
Yeah.
About the nice patients that you have with big extended families in the area. How about while you're treating them and talking about your short staffing situation, ask them if they know anyone.
Yes. Personal referral. Yep.
And also, Cindy, yes, I completely agree. You have to be creative now more than ever. And Indeed and you know, monster.com, they're all great, but at this point in time, you've got to be more creative than that. So in addition to asking your patients, and in addition to the power of social media, I would also recommend taking a look at some of the community colleges in your area that might have an LPN degree, a 2-year LPN degree, and they often have, and this is one of the strategies I just recently employed, they often have job posting on their websites, and
Right.
it's free, completely free to use. And the students can, it's not only goes to the students, but it often goes to their alumni as well. And people might be looking for jobs through that area.
Right. You have, but you don't know unless you ask. And that's the thing, you have to ask. And a couple of my practices have found people that they weren't expecting. And even friends of the employees that are there, that they do have,
Yeah.
what about them? You know, like attracts like. Their friends probably aren't going to be that much different than them, right? So, you know, you have to do whatever you can do. One of my practices, I was able to place a virtual assistant with them. One of my doctors had retired last year, and he had one of his employees that worked with him for 20 something years. She worked in every position in his office at one point or another. And she called me and she said, Cindy, I don't know what I'm going to do. I only know podiatry. I don't, you know, but I really can't move. So I said, hold on a minute. And I have a practice who's constantly short staffed. It's just a revolving door. And she kind of has got them through the past at least 6 months as their own front desk person, you know, whoever that is for the moment will be there and then leave. We forward all the calls to her. The phones go to her. She's not even in the same state, but she makes it so that they don't miss that person who needs to be seen the same day. You know what I mean? She's not missing. She's not in the way. She's not at risk of being exposed. She's not calling in sick because she's working from home. I mean, that's ideal now. I wish we could have someone that you set up at your front desk, you know, like those virtual poker things at casinos. There's just like a face, like a head. It says, welcome to our practice. This is how much you owe for your copay and your outstanding insurance.
That's John, what you began with, saying that if you can outsource something, now's the time to look at how is that going to help me? And that's the perfect example of it. Is we all know the phone calls or the phone is the first impression. It's very important that that's answered in
Right.
some manner, whether it's offsite or not. But a lot of doctors are afraid to outsource that. And there's so many companies and there's so many, like you were saying, virtual assistants, whatever it is, that specifically do that. And it can work really well. Now's the time to try it if you haven't.
It is 100% understandable about their apprehension. The fear of the unknown is a powerful entity, right?
But right now, something is better than nothing.
I was just going there, Cindy.
Yeah.
Again, this is what separates the thriving physicians from those who are left behind. Take your pick, right? You've got to be willing to change. You've got to be willing to adapt, or you're going to be left behind. Everything is changing. This pandemic only accelerated and magnified the change. And I can't tell you guys how often, more than 6 to 10 times over the past month and a half, I heard a doctor actually say, I think I just need to close down for a while. So you're telling me that closing down is a better option than rolling up your sleeves, automating, outsourcing, never stop recruiting. You're telling me that closing down is healthy for your business. It's healthy for your finances. It's healthy for your patients' outcomes. Now there's somebody that understands change.
It was bound to happen, you know, it's like, it's this time of day.
Well, one of the things, John, you said a couple times is, you know, rolling up your sleeves, but I always looked at that, and we did it as earlier practitioners, but there's a lot of doctors that have no idea what each job in their office does. And that's very concerning. And this is a perfect opportunity because now you're being forced. What does it mean to do moving a patient from A to B? What's really involved in that? It's not just calling their name and expecting them to go in there, but now you're going to realize if you haven't done every job in your office, shame on you, because and if this is forcing you to do that, you're probably struggling like crazy because it's impossible to do every job, but you need to have done it at least once or twice to understand it. And
well, that's some of my newer doctors. Even though they're super short staffed, or there's days that they are literally by themselves, they'll say to me, thank God you forced me to do all those trainings with my EHR, because I wasn't going to do the ones of how to schedule a patient, how to check insurance. I said, you need to know how to do everything. I mean,
Write down,
get through it.
right down to billing. And that's something that is a whole nother topic. But I can't tell you the number of colleagues and people that you've probably dealt with have no clue. If the billing company had a bomb and it exploded and they couldn't send the claim out, they would have no clue what would be involved with that. And that always leads to understanding denials and understanding why you're getting denied. There's a whole cascading event. Right now, I wouldn't be focusing on that if you're in this pandemic and you're just surviving because you have no help and you're trying to do all that, because the billing aspect of it is a huge amount of training you need to understand. Getting patients in, getting them out, scheduling them, moving them from A to B, taking x-rays, rescheduling, having your phone answered, doing your charts on time. Those are all the major categories. And most people can just sit down. These are the 5 things that have to happen from a patient A to Z. And you're an expert at that, Cindy, but they need to understand how to help themselves. So,
this is sort of like, it all goes back to basics, like you're saying.
Yeah.
Right? So for me, the worst thing you can do to a new employee, and this is what happens all the time when you're short staffed, you overwhelm them completely in days 1 through 3, and day 4, they don't come back because it's too much. It's like the person that left had been there for 10 years. They didn't even think about what they did, and they did so much. And you're expecting this person, like, let's go. We need you up to speed. We have nobody. So it's just slowing everything down. And I mean, I know, with the background of both of you, you'll want to put your fingers in your ears when I say this, but when you're short-staffed, all you have to worry about is getting the patient through and listening to the patient and still giving them your attention. And I say, forget the stupid electronic charting, forget it. While they're there, have, even if it has to be a piece of paper, some way to record everything that happened and didn't happen during that visit, so you can chart later. This is the only time I'll give doctors the excuse, like, okay, you're not keeping up with charts every day, but we at least need to know what we did and forget about the stupid charting.
As long as they're not violating any principles, yes. You can
Right, just get through the patients.
Right.
Well, John, unless they had speakeasy, then they could just dictate it in 2 words, the chart would be done. But that's
There's
not
the shameless plug.
Of course. That was like a feed-in for you, Jeff. That's it.
Well, that goes under the automation category. Charting should be automated for you. Speakeasy is, you say it and it dictates out all the verbiage that LCDs for your chart. So, and if that's becoming a problem for you, that needs to be looked at also. Like, why am I spending so much time on this? I can't even get in front of the patients, let alone I'm the only one here, which makes it almost impossible.
Yeah.
It is. I'm going to tell you a story because I wanted to circle back about hiring, because here's my 2 success stories about finding people in a difficult time to find people. And now it's even going to be more difficult because I used to find people as waiters and waitresses. Best customer service ever.
Yep, they're
They're easy to steal, but now there's not that many of them. And in the past, they were very abundant. You go into a restaurant, you figure out this is a great person. They understand customer service. I can freaking train anybody to do what I need to do in the back office with some level of intelligence. I used to steal those. And the other place I used to recruit from, and I don't know if it's still true, but I'll just mention this, the medics that would get out of the Army or the Navy or the Marines, when they leave, they're required to register with the unemployment office that they're going to go look for a job. That was a requirement. I have to check to see if it still is. So I would go on the unemployment site for Michigan and I would put in veteran, and up would come everybody that just got discharged that already has a medical background. I would hire these people because discipline was number 1, get the job done was number 2, and number 3, I hardly had to train them on medicine. They already knew antibiotics, they knew infection, I didn't even have to come to the office half the time and I hired 2 of the best people I've ever had through that process. Through the veteran issue. So, and maybe it's just a temporary, maybe they just, looking to find what they really want to do, but you could have them for 1 year to 2 years while they're in that process. So those are the best quick hires you could ever find. Because Navy people and Army people don't want to sit around unemployed, believe me. So just I thought I'd throw that out as possibility places to look.
Good thoughts.
So it's tough. I mean, I don't think it's ever been tougher. And like
Yeah.
John was saying early on, whatever we've taught you over the years, yeah, either put it on pause just for a little while longer until we just need to get through it. And we will, because, starting in March of 2020, we didn't know what to do. And then we kept having to adapt. And like every time we figured it out and we had a system for it, something changed and we adapted. And so, most of my doctors, they had the best 2020 and 2021 that, the best years they've ever had. How was that possible? And it was because they had less patients. They had the time to focus on, the treatment protocols that we spent a dozen hours developing. Oh yeah, let's go back and look at them and make sure we're not skipping any parts of those treatment protocols. And now if you have a day that looks like it's going to be crazy and it was 40 patients and it turns into 25 patients because of cancellations, okay, that's potentially lost money, right? But then again, what were you going to skip because you didn't have the support staff with 40, but it's much more doable at 25. Like
John, that concept is called, or at least I coined it, as managed neglect. You're managing patients, but you've been neglecting them because you're too busy and don't really follow your own protocols.
Right.
And if you, like you said, those 25 patients versus the 40 can be a lot more satisfying, better outcomes, and obviously more profitable. There's no doubt.
And this is where the overarching story is going to be that some doctors are going to learn from this pandemic, adapt, and become superstars, and others are not going to change and they're going to be left further behind.
Right.
And Cindy, that's where you come in. You can't let that happen as a consultant. And those practices that I help with, we can't let that happen. But we can only lead a horse to water so often, and if they don't drink, there's not much we can do. But that's going to be the overarching takeaway when we look back a decade from now or 5 years from now on the past several years. Superstars will be born and others will be eliminated.
Right. Can I just bring up one thing, Jeff, you mentioned about billing. And that may not be your primary focus right now with everything else going on. But if you decide to take your schedule and condense it, and so you make your routine foot care Fridays and you condense other days because there's not enough staff to cover 5 days or 4 days a week, and you break it down to 3 days a week. Those other 2 days, yes, you're going to be catching up on charting and maybe, doing your own inventory and ordering supplies and sterilizing instruments. Okay. But what about that time that you have now to look at your AR? And as you're seeing less patients and you're worried about the situation between deductible season that started over, which now deductible season really never ends with deductibles nowadays, but now that it started over in January, blessing in disguise is usually a less busy month anyway, right? So now look at your AR. And I've been helping some doctors recently. It's like 90 minutes of Friday we spend looking at how poor a job her billing company is doing. And it's like, you're paying me to do this with you when that's their job. Yeah. And why are all these stupid rejections on here? Why are we not figuring out that we've been using the wrong payer ID, for UMR for the past 7 months, when it's all right there. There's a scan of the front and back of the insurance card. Look at this, the payer ID doesn't match where it's being sent, and why? So use the time that you have to look at those things.
And even more elusive than ridiculous rejections, Cindy, is this opportunity gives doctors the time to really appreciate whether or not they're even getting paid an appropriate amount. That's more elusive than the rejections. Some doctors are going to be absolutely shocked and finally take action to the reimbursements that they're getting that they're probably not even aware of.
I mean, that's been something that's come out of this as well, is all right, we have time to look at this. Let's look at it. Let's see how much you're getting paid from some of these, managed care plans. Let's look at how much time you're averagely stuck in that treatment room, and you're making a whopping $23 for that visit. So, the Dunkin' Donuts and Target and Burger King, they're paying more than that an hour. So, weigh your time, see what, as the doctor, your time is the most valuable. It's worth the most money in the practice. And if you're not moving and you're not seeing the right kinds of patients, then maybe it's time to drop the payer that causes you the most headaches.
It's a weird concept for most doctors. It's always been see whoever you can, as many patients as you possibly can on whatever insurance. And that's certainly an old school thought that is antiquated and doesn't translate to success in today's environment. John, if only there was a book written about being successful in practice.
Uh-oh, here's another shameless plug, Cindy.
I would stand up. It's way back there, but I'm wearing shorts, so I don't want anybody to see that.
Sure, he's wearing shorts. Yeah.
Yeah, the $1 Million Practice, John. I heard you wrote it.
Oh my God. Yeah. Just take action. It doesn't matter to me whether you buy the book, just take action. You can't sit back and not take this as an opportunity.
And I would second that, John, with point 2 of take action is don't do everything the same you've always done it, because what you've done in the past may not be suited for today's COVID environment. And
Most likely is not.
Yeah, and the other piece is embrace change, because if you don't, you're going to go the way of many corporate big companies that went under for many, many years because they never changed. They just stayed with their same little formula. And John, and you know too, Cindy, from talking to very successful practices, they all have one thing in common. They're always looking for something new, always changing and adapting to the environment.
Right. Well, I think
Absolutely.
that's good. That's a good note, I think, to end on. So thank you both for joining me and for participating. And we'll get this on as many platforms as we can. Thank you.
Excellent.
Thanks for hosting, Cindy.